My name is Armine Afeyan. I have the privilege of leading the Aurora Humanitarian Initiative. I'm just going to say a few quick words before we get started. As you can see, we have an absolutely loaded lineup. You're in for a treat. Where I wanted to start this morning is a pretty simple question, but one that I know in a week such as this, with such high opportunity cost to choosing to be here, many people may be asking themselves, which is, why am I here? If you find yourself asking yourself that during the panel, maybe a sign that something's going wrong. But if you find yourself asking that right up front, I think it's a pretty good sign. You can think about, why am I here in this room? Perhaps you have a badge or a phone or a team or yourself that told you to be here. You can ask yourself, why am I here in Oxford during the Skoll World Forum? Hopefully it is to make new connections and learn new things in a world that needs people like every single one of you fighting day in and day out to make it just a little bit better. And then, of course, if you're feeling philosophical on a, Thursday morning, you can ask yourself, why are you here on this earth? For me personally, I am only here but for the grace of God and several individuals who along the way stepped in to help my family so that we might be here today. And the spirit of the conversation today focused on scaling global support for locally led initiatives. That's going to ensure that other rooms like this can exist 10, 50, 100 years from now. That is going to be the why so many people continue to be on this earth, thriving and hopefully themselves choosing to contribute to the survival of others. So whatever your reason for this room, for Oxford, for the world, I thank you for being here. Again, you're in for an absolute treat with this panel. I hope you enjoy yourself. I hope you continue to ask yourself why, and I hope you have really compelling answers. I'm going to hand it over to Aurora's co-founder and my own, Noubar Afeyan.
Good morning. I saw some of you at the event yesterday, and don't fear, I'm not going to talk about artificial intelligence. I'm here to talk about Aurora. I'm co-founder and chairman of the board of Aurora Humanitarian Initiative. And as you see, we have a great lineup, and so we want to get to it right away. But first, I want to take you back to 1915. Imagine a train lurching across a hot desert carrying thousands of Armenians packed in railway carts, being sent to a forced death march in the desert. This is happening during the Armenian genocide. At one stop, 2 German soldiers board a train. They come across 2 young men around their age, and for some reason they decide to pull them off the train, saving their lives. For 3 years, until the genocide was over, mostly, those 2 young men stay at the station doing for others what the Germans did for them. They save many, many more lives through subsequent railways that were going through, train cars. That's the first story. The second takes place in modern-day Sudan, in the city of Omdurman. Civil war has been raging there for 3 years, and much of the city is reduced to rubble, including schools and health facilities. Yet even as the health system is collapsing, the Al-Now Hospital remains open as a lifeline to tens of thousands of people under the leadership of Dr. Jamal Al-Tayeb. Despite extraordinary circumstances, Dr. Al-Tayeb has continued to treat pregnant women, sick children, and civilians wounded by war over the past 3 years. Who's to say how many lives he saved? And he's there now, even as we speak. Now, the first story is the story of my grandfather, Bedros, who escaped death during the Armenian genocide thanks only to strangers' kindness. Of all things, German soldiers who were there helping the trains march people to their death. But in this event, they saved my grandfather and his brother. And it's stories like these that inspired us to launch the Aurora Initiative in 1915 at the centennial of the Armenian genocide. My co-founders, Ruben Vartanyan and Vartan Grigorian, and I had seen through our own family histories that in times of crisis, the people who did the most to help were just ordinary people. They saw suffering around them, and they did what they could to alleviate it. So we asked ourselves, now 10 years ago, how can we support the people who are doing the work of those German soldiers today? How can we pay our gratitude forward and help them do more? That brings us back to the second story. Last November, when we awarded Dr. Al-Tayeb the Aurora Prize for Awakening Humanity, You see, Aurora as a prize has some interesting features. Among them is that it's $1 million to help him continue his life-saving work, but at the same time to pay forward where he gets to donate parts of that money on an annual basis to others whose work he wants to encourage and support. And so this is a very direct lineage and continuity of things that happened a century ago that are continuing, unfortunately, to happen in the world that we live in today. In this era of what I call inhumanitarianism, I think humanitarianism is a much more popular word, but a lot more applicable to a lot more people in the planet, is inhumanitarianism, unfortunately. And I think in this era, it's easy to overlook the spark of common humanity that we see in Dr. El-Tayeb and that we recognize from thousands of similar stories of heroism that the Aurora Project brings together on an annual basis. The fact is that this kind of activity sparks that feeling of humanism in all of us, and our mission at Aurora is to breathe life into that spark of common humanity, to turn it into a flame that can brighten our darkening world. We do that by recognizing the grassroots leaders, and that we recognize that grassroots leaders know best how to respond to these challenges in their own communities. We do it by helping those leaders share their stories. We believe in this tenet of gratitude in action, the idea that one good deed can have ripple effects as it inspires its recipient and all those who hear about it to in turn perform good deeds of their own. Sounds very formal. And finally, Aurora achieves our mission by giving grassroots leaders the resources they need to continue and expand their work. We build trusted relationships that go far beyond big moments like the Aurora Prize, and that's what our conversation today will be all about. And I want to now turn it over to our esteemed moderator, Isabel Choat of The Guardian. Thank you very much.
Good morning, everybody. And thank you so much for coming. My name's Isabel. I'm commissioning editor on The Guardian's Global Development Desk. We cover development and humanitarian issues. I'm no expert in the funding sector, but fortunately we have 4 people who are experts. So I would just like to introduce them quickly. First of all, we have Jamila Afghani, who's an inspirational human rights campaigner. She is president of the Afghan Women's International League for Peace and Freedom. There are few areas that Jamila hasn't worked on, I think. She works in education, gender, political participation, GBV, as a leader of an organization working under gender apartheid. She has a unique view of the challenges of galvanizing support for a crisis that has largely fallen off the headlines, sadly, but continues to bring suffering to millions every day. She's now living in exile, but is very closely involved with the running of her organization. And when I spoke to her a few years ago, she said she longs for the day she can return to her country. Also, when I spoke to her back in 2021, there was one thing she said that really stayed with me. And she said that no darkness is forever and no cruel, abusive regime can remain. And I just thought it was really inspirational, and welcome, Jamila. It's a privilege to meet you in person. To my left, we have Lucy Puentes, Director of Network and Funds at START Network, an alliance of more than 140 humanitarian agencies across the world. Its launch in 2012 was born out of frustration that the aid system was not meeting the challenges of the 21st century. In 2014, it launched the START Fund, which responds to small-scale crises that affect millions of people, but often pass unnoticed. The START Lab was established specifically to encourage new thinking and ideas in humanitarian funding. So she'll be giving us her insights into some of the innovative ways that agencies are using to overcome some of the barriers of the sector. Anna Hakobyan, Chief Impact Officer and Executive Director of Nutrition at the Children's Investment Fund Foundation, private philanthropic organisation with a focus on children and adolescents. Again, it aims to be ambitious, nimble, take risks, but also to invest in long-term solutions. So hope she'll be talking about how you balance those two things. Finally, but by no means last, Sally Becker, another inspirational woman who's been helping children in conflict since 1993. She's credited with saving hundreds of children during the war in Bosnia. In 2016, she founded Save a Child to help children in areas of conflict around the world. And I'm not sure if there are any filmmakers in the room, but if they are, I think they should speak to Sally because her life is, and her life's work is extraordinary. So welcome everybody and thank you for being here. I just wanted to start by I know we don't have much time, but a quick kind of recap of the situation we find ourselves in this era of in humanitarianism, as Noubar put it. Last year we saw a historic decline in international aid. According to the OECD, it fell by 23% in 2025. Obviously, much of that was driven by the dismantling of US aid, which fell from 17.3 billion in 2022 to 3.4 in 2025. Obviously, US is not alone in cutting aid. I think 17 EU states have cut their budgets. The UK is reducing its budget to 0.3% in 2027. I think Farage and Badenoch would probably reduce it to nothing. Obviously, all of this comes at a time of greater need, the climate crisis, multiple conflicts, fueling migration, food and water insecurity, sexual violence, disease. And those two things are having a direct sort of devastating impact, causing preventable death and suffering. In September last year, The Guardian told the story of one woman, Fatima from Yemen, who was pregnant and who died during labour as a direct consequence of the funding cuts that meant her nearest hospital couldn't provide the emergency care that she needed. And then in February this year, we reported that aid cuts could lead to more than 22 million avoidable deaths like Fatima's by 2030, including 5.4 million children under 5. So on that unhappy note, I'd like to start by just asking each of our panelists how the Great Aid Recession, as some people are calling it, has impacted the work you do over the last 18 months, and if you could sort of give us a sense of what it's like to work under that kind of pressure during this crisis period.
Thank you, and thank you for having me on this panel of incredibly inspiring women. It's always nice to be amongst fellow women. So yeah, over the past 18 months, from the vantage point of Start Network, with whom I work, we've seen how funding cuts have affected all organizations who are operational and play a role in terms of responding to humanitarian need worldwide. But the vast majority of local and national actors have been hardest hit. And I think you have to sort of set this, do you call it the Great Aid Recession, against a backdrop of local and national actors, so those are very much at the forefront of crises, on the sort of front line of humanitarian response, already being in a situation where funding is rare, it is difficult to access, it is unpredictable, and it rarely covers the basic needs of any organization. So organizational resilience is something that's just tremendously hard for many local and national actors in these crisis-prone contexts to access. And what that means fundamentally is they don't have the resources to keep the lights on. They don't have the resources to ensure that they have staff that can be paid, that can do the things that we may take for granted, such as go on maternity leave, such as take sick leave. And they certainly don't have the resources beyond that to actually meet the needs and the wants of the communities that they serve. So I think those organizations are very much in peril, and I've heard it be described as a system that is fed from the top down will starve from the bottom up. And I think that's precisely what we're seeing and what we're hearing from local actors. The other thing is trust. So I think the humanitarian system operates with certain principles at the forefront, humanity and impartiality being some of the most significant, the most imperative. In order for us to play a role in serving humanity, we need to be able to access communities when they're at risk, communities when they're affected by crises, and understand what it is that they need at that moment in time. That access assumes that there's a trust, it assumes that there's an understanding, and when humanitarian actors are unable to fulfill their humanitarian mandates, you lose that trust. I think that trust has perhaps been lost most with the international actors. The international actors that are very much at the heart of this humanitarian system that we have, and who have demonstrated an inability to change, to meet the moment, to reform.
Thank you, and thank you so much to Aurora, to Armine and Noubar for that inspiring opening as well. And Armine, I'm going to be philosophical and try to think about the latter part of the question after this, which was quite a thought-provoking one. So it's I think as it has already been mentioned, it's been quite devastating, several months for the sector as a whole. We've already talked quite a lot about the challenges, which are very real. I will try and talk about some of the solutions or what we're seeing also in the field in terms of mobilization. What we have been observing a little bit more on the positive side, we have been seeing much more coalition building and alliances coming together. So whereas before sometimes we would see much more polarization of the sector and the organizations, each trying to do their own thing, we are actually noticing the ability to really come together much more strongly, which is really going to be essential. This is also true about the donors and funders. So CIFF in the recent few months has really been trying to mobilize resources, particularly for humanitarian settings of conflict-affected and fragile settings. This is new for us. We've been in the development funding space for over 2 decades, but it was particularly last year that we decided to also start funding in fragile and conflict-affected areas. We've committed ourselves over $140 million for these causes, but we really wanted to make sure we bring others along. And so we're mobilizing an alliance, and this will be tripled and quadrupled. Already we're very hopeful because we've had pledges from other funders to really look at these issues. I think also what's really maybe important to highlight, solutions do exist locally. This is also both with local grassroots organizations, but also even within some of the provinces and local areas, because oftentimes we look at countries as a whole and people say, well, this is such a difficult, complicated setting, you cannot do anything. But a lot of these countries are very decentralized with local governance and local authorities, and you can sometimes find the trailblazers and the innovators within those local authorities and try working with them and hopefully showcase that and spread the good practice. So that's another area. We have been very much trying to create financing mechanisms such as the Child Nutrition Fund, which is trying to address the big cause of malnutrition. We all know more than 45 million children at any given time suffer from severe acute malnutrition with devastating impacts. And investing in nutrition brings $1 to $23 returns on your ROI and investment. So through this fund, we're actually incentivizing the local governments, domestic governments, this could be provinces, have to put their own dollars, and that's really matched then by the fund. And we've had one-to-one matching, and we're now increasingly seeing some of the authorities are able to put 6-to-1, 8-to-1 matching, which is really incredible to see, and it's important for sustainability. We shouldn't be forgetting the private sector and that the market has its place. Sometimes as philanthropy, we get overly excited and enthusiastic and we want to solve all the problems ourselves, but the market sometimes can regulate itself. Just to give one example, related to nutrition, prenatal vitamins for pregnant women, which has very solid research and evidence. It helps improve newborn outcomes for babies. And yes, there is a public sector distribution, which a lot of the organizations doing, but there's never going to be enough funding to supply this to every woman. And in a number of countries, this only can cost $3 or so for a whole pregnancy. Women are willing and able to purchase this. And so the role of the philanthropy is then helping support local production, which also creates jobs in these difficult settings, and make sure that there is a quality of this product, so it's not a Wild West, they meet the required WHO standards, and really turning the tide so that women become consumers and hold us to account versus being beneficiaries of aid.
First of all, thank you, Aurora, for having us here, especially a person from Afghanistan, that almost we are thinking that Afghanistan is forgotten by most of donor and international community. About the impact of cutting of fund, as you know, when a situation is getting worse, the major impact is on the local people. And unfortunately, the sudden announcement of funding cut in Afghanistan, all over the world, but especially in Afghanistan, it was really, really unexpected, because the international funding and civil society organization activities are the only remaining hope for women of Afghanistan. It's the only remaining hope for women of Afghanistan. And it is also taken away. My organization it took 2 years to communicate with USAID, with bureaucratic system, to get approval of a funding. And when we signed the agreement, after a month, it was cut off. More than 100 women, skilled women, they got out of their job all of a sudden in the winters. And it was a chaotic situation. I cannot tell you the stories of psychological impact they had and economic impact in their family. And it also impacted other donors who were funding us in different settings. For example, the organization who were giving us like 100K as a core fund or for any activity, now they are able to fund us up to $10,000. And just imagine the activity we are doing under such a difficult circumstances. And with the small drops and small bits, still women are working. So I salute, I appreciate my sisters that still they are working in Afghanistan under such a difficult circumstances. I always say, Afghan women are just like the mountains of their country. Through all the hardship, the sun, the rain, the storm, whatever, they're standing firmly on their position for the hope of a better tomorrow for their country, for their children.
Do you want to talk a little bit about the impact that the aid cuts have, or perhaps we should go on to the next question, which I was going to ask both Jamila and Sally. You know, you're in a unique position of working with grassroots, or well, Sally, you run a grassroots, a small organization, you founded it. Jamila, you work with grassroots organizations. What are the barriers to that you see to funding of small organizations, and Sally in particular, responding because you work in conflict zones? How do you work with funders when your work relies on kind of acting at speed in order to be effective?
The current funding guidelines particularly are misaligned with emergency response in conflict zones, but it seems to have been this way ever since I can remember. For example, back in Bosnia, when I first started in 1993, I was asked to help a group of about 28 critically injured children and their mothers who were trapped in a besieged hospital in Nova Bila in central Bosnia. So I went to the major organizations and I said, can we do something? They said, well, first of all, you have to have funding for transport, so that will take several weeks. You need to get visas for children. You need to get hospitals abroad to accept them. So you're probably looking at 2 or 3 months to be able to help. And that didn't make any sense to me. So I got permission from the warring parties on both sides to be able to help these kids. I couldn't go in by road because there was snow on the ground and no aid organizations could travel to that area. So I went to see a helicopter pilot, a Croatian helicopter pilot, who agreed to fly me in. And we had to go at night without lights because of the anti-aircraft guns. It was a no-fly zone, but I'd informed the UN what I was doing. And we took our chances. We flew in, found the children at the hospital with their mothers, and there was one girl who'd lost both her legs in an explosion that killed her father. And she'd been waiting 3 months to get out of there. Anyway, I was able to fly them out and take them to a hospital in Split in Croatia, where they spoke the same language and the doctors were able to give them the treatment they so desperately needed. But that's the way it's been for 30 years. I've been working in so many different areas: Ukraine, northern Iraq, Syria, Gaza, Afghanistan, all these areas, it's the same problem. Small organizations like mine who need to act quickly cannot get funding from the big organizations. It's impossible because it takes weeks, first of all, to fill out an application form, and then it takes months to get the funds, and by then the children would have died, some of them. So we're reliant on private donors who have been amazing. I'm able to contact someone and say, please, we need £17,000 to do this mission, and we have the funds in 24 hours. Obviously, it's not always possible, but that's how we do it. We rely on private donors, on small foundations, but it's time now that the bigger organizations recognize the work that the smaller organizations are doing, but also the work that people are doing on the ground, the doctors, the nurses, the midwives who are helping in their own communities, and they're trying to support their families at the same time, and they don't have money. So we're also focusing on doing that, on helping staff in a clinic in Gaza, for example, to be able to treat the children every day. Because without those people, I don't know what would happen. They're saving lives every single day. And I just think it's vital that we find a way to do this. And I think Aurora are actually looking at this the way no other organization has ever done. So I'm delighted to be part of this.
Sally, can I just ask you, are there any, or what practical or concrete steps could larger organizations take to address some of those issues that you've just outlined?
I think of it has to be based on trust, because you can't follow all these rules, compliance and due diligence and risk mitigation. It's impossible when you've got children who are going to die if you don't get there quickly or don't get someone else to be able to help them who's already there. It's just a case of trust. We have to be able to show what we've done, what we're capable of doing, and then ask them to trust us, and also to work together with other organizations.
Lucy, I wanted to ask you, the START network sits between kind of large donors and frontline responders. So you have a kind of overview of how the sort of unique overview of how the system works or doesn't work. What are the biggest bottlenecks in getting money from funders to local actors? So the sort of things that Sally and Jamila have been talking about with minimal friction. Have you seen any solutions that are, or any changes that are attempting to address that?
START Network is a network of NGOs, as you described earlier, and it's tricky because I think this humanitarian system, so the system was established in the wake of the Second World War. That's when the architecture was built, that's when the scaffolding was built. And since then, we have seen a rise in humanitarian crises. So we know that now, when it comes to conflicts, they're more protracted, they're more intractable, they're more frequent, they're more severe. And we also know that climate change is creating a warmer, wetter world, so there's many more crises that are driven by climate risks. So we have this landscape of just crisis upon crisis upon crisis. And it's not the humanitarian actor's role or the system's role per se to resolve all of that. A lot of this is political. When it comes to conflicts, you know, there is a geopolitical need for our leadership to be actively pursuing peace. There is a need when it comes to climate change for our political leadership to have ambitious plans to deal with the drivers of climate change and to then also be helping us to respond, to adapt to this world that we're entering into, this new era we're entering into, where we're seeing more severe, more frequent climate crises. So I think there is a bigger picture here that we cannot sort of disregard. This is the world in which we're functioning. In terms of the system, the humanitarian system, and how it can enable sort of this funding to flow, we've got commitments. So the World Humanitarian Summit 2016, we had agreed as a community, as a sector, that local actors did indeed have an important role to play. They're at the front line of these crises. They operate with the communities. They are much more accountable to those communities because of that relationship that they have. And they therefore should receive at least 25% of funding as directly as possible. One of the difficulties with realizing this metric of success has been the fact that it's been so narrowly prescribed along financing. So if we're just looking at moving money, then we're not looking at the bigger picture. And when it comes to moving money, we've been very unsuccessful. I won't labor the point of how unsuccessful we've been, but we haven't reached that 25% or anywhere near it. During the pandemic, many people thought that could be the tipping point. So many international actors, many international staff were not present. Local actors remained present. Why wasn't it the tipping point? There was a big UN evaluation that was conducted for the pandemic, and one of the findings was really quite outstanding, and it said, despite years, if not decades of capacity building, when the moment came, local actors were still not felt to have the capacity to lead the response, which really beggars the question of what capacity building was doing. What are we doing? We're clearly not doing, if there's no exit strategy, then there's no goalposts, or you're moving the goalposts. To come to some more solutions, not get bogged down in all of the problems. Local actors, I think I'll come back to Sally's point on trust. So when you work within a network and you share a common mission, you share a common vision, then you can work as one. You can be a movement for change. You can build the relationships, you can build the trust, you can understand one another enough that when the moment comes and there needs to be funding for a crisis, you already have the relationships with the organizations. So that eases, I guess, the flows. But you don't have to wait for a crisis to happen in order to get the financing where it needs to be. We know that the majority of crises, particularly climate-related hazards and risks, are somewhat predictable. There are systems that can be developed in advance of a crisis onset. We can model the hazard, we can set triggers that when rainfall when we don't have the rainfall, we know that there's a drought that's imminent. We know that we could start acting early to mitigate the humanitarian impact. So there's work that can be done around pre-arranged financing. There's work that could be done around making that financing more predictable for the local actors. And then as a system, coming back to sort of the compliance issue that we have, we can look at things like due diligence passporting. So do we each as individual donors all have to have our own personal eligibility regime, or can we all work to some common consensus? And when one actor passes through the due diligence process, could we all accept that they have met the eligibility, they therefore can access multiple pots of money? So there are different, I guess, levers that can be pulled.
Thank you. I just wanted to ask as well, which ties into what we've all been talking about. It's long been agreed, as you just laid out, since way before 2016, that local actors are best placed to deliver programs and services and should be being funded by a minimum of 25%. But those local organisations are under such pressure and are constantly now, because of everything that's happened, even more firefighting every day. Like, how do they carve out the time, the resources to, how to work with funders? Like, how much can, that seems to be quite a contradiction, that we want to help the on the ground organisations, and yet those organisations are just consumed by, lurching from crisis to crisis. I'm not sure who wants to answer that, but perhaps Jamila?
I hope I have got your point correctly, if you summarize a little bit.
I'm sure, Afghanistan is a good example of that local organisations are in a position now, even more so now, where they are going from crisis to crisis. They're constantly firefighting, they're losing staff. You might be losing the staff who can, whose job it was to, have relationships with funders. Like, how do you, how do you manage that situation? What's the solution to that?
Thank you very much. Yeah, of course, unfortunately, Afghanistan is a unique country in this world, in this civilized world that is run by a government or by authority, that their regime is apartheid, gender apartheid regime. So since Taliban took over Afghanistan, they put aside all the rules and regulation we had, and a single man, head of Taliban, issuing orders. And based on his orders, we have to manage and run the country. And out of the hundreds of the edicts that he has announced, 90% of the edicts are against women. And especially recently in January 2026, they announced a criminal code. It was the hardest hit on the situation of women in Afghanistan. And they allowed man of the family to be able to beat women, to torture, to have any kind of role or command over the women. And of course, on social level and political spheres, women are completely disconnected. And women NGOs, they remain always in front line. They have remained always in front line of help and services. Even during the former regime, because of the fighting was going on, government couldn't access to those areas. But these women NGOs, local actors, were reaching out to people. And in my organization, just I'm giving you example of my organization, and of course it's not the only organization, like many other organizations, and Sakina Yaqubi Cyber organization also. We are people under pressure for more than 5 decades. And now we are, every step we are taking, we are waiting for another hardship to come on us, because it's like coming one after another. And women are resilient and they are innovative in the way that no one can imagine. Maybe I can give you an example to explain my point in a way. So we are running a lot of underground homeschools. Those teachers who were kicked out of their jobs, now they are running homeschools, and we are facilitating a little bit that they can continue their work. So one of the women was telling me that somebody complained to Taliban that there is a center and girls are studying there. So all of a sudden, Taliban raid is coming. And we do another thing, that we give salary to a member of the family to guard the centers. Because right now we cannot have official offices. Now we are small bits everywhere. Our homes has become offices, schools, organization. So we are working in this scattered format. So when man of the family realized that a group of Taliban are coming, and he noticed, immediately informed the family that Taliban raid is coming. So all of a sudden, these women are putting their books under the cushions, and they are wearing colorful chadars. And one is playing drum, the other is singing, and the others start dancing. When Taliban raid is coming in, and the mother of the family starts shouting that you have no honor, you have no dignity, this is Afghan culture, this is Islamic country, why you are coming to our home without permission? And those Taliban raids, they were so much embarrassed, they were ashamed of themselves, and they said, oh, we thought there is something. Then the mother of family was shouting that you are not courageous, you are not a good Muslim, you are not a good man, you should be ashamed of yourself. And those men were so embarrassed, and they went away. So just look at the innovation or the way they are dealing with the situation. As I said before, like right now, the funding hit in Afghanistan has been very huge. As I said before, it is the lost hope for Afghan women. But still they are continuing the war. They are still managing. Like women, through digital platforms, they are engaging with one another. And even we living outside Afghanistan, we are again connected with our members all around Afghanistan. And before, like we were working in different offices in a few populated provinces. But now we are scattered in every corner of Afghanistan. Now we are having our capacity building programs. And right now, 520 women grassroots leaders are taking continuous capacity building training for the past 2 years. And as I said earlier, and I will repeat it now, and this is my belief, that the dark night will not remain forever. It will be changed, and we need to help and support each other for that day to come. And international actors, funders, like Aurora, they are in the best position to help us. Like nobody is trusting on women organizations, small women organizations, but those organizations can help and support us to carry on our precious work that we are doing. Thank you.
That might be a good moment, I think, to, we were talking about this before the panel, to acknowledge those women, not just in Afghanistan, and not just women, but people who are doing this work right now, as we speak, in this beautiful room, who aren't able to be at this table, but who are, literally at the front line right now. And I just wanted to acknowledge that on the panel. I don't know if we've got, I'm going to look at Colin. Yeah, I think maybe we, I wanted to ask, I've got lots more questions to ask, but I think maybe we should, one more? One more? Okay, sure. Okay, I wanted to ask, so, I mean, some of the reporting that we've been doing at The Guardian obviously is focused a lot on government aid cuts. The response of governments is usually, oh, don't worry, we still support we still support development and humanitarian efforts. We're just going to do it in a more creative way, and we're just going to be more imaginative, and yeah, everything will be okay. Don't see it as us not, not caring about these issues. So, which is all great and all well and good. I just wondered. Perhaps this is a question for you, Anna. How organisations balance being creative, being nimble, being innovative with the need to for like kind of long-term investment, for creating an environment and a sort of secure environment, so that some of these crises are less likely in the future. Like, how do you balance being fleet of foot and creative with the need to have long-term investment?
Yes, thank you. Thank you. Thanks so much, Isabel. And yes, indeed, I think as a result of the aid cuts, private philanthropy, like ourselves, is being torn in many directions now. Our belief has been, historically, that philanthropy should not be doing general service provision. We should not be displacing public services. That's not our role. We should be doing more catalytic things, taking on riskier initiatives, and building up innovation for the future. And all of those. But with those aid cuts, what do you do as a philanthropy when overnight those cuts are made, and then there's a lineup of people in a village needing trachoma surgeries, and if you don't provide the funding immediately, they will go blind permanently. So this is really super sensitive time-wise. You can say, and indeed some philanthropies have taken the view, still it's not our bucket of work. But you can also, for us, it's been hard. We haven't been able to say no. We have actually gone back to doing some of these emergency reliefs, and we've done, search fundings to address this immediate life-saving work. But we're also trying to balance and make sure in the portfolio we are retaining features. We're also future-proofing the system and the architecture. I think maybe a couple of examples. One is we have been supporting. It is so hard for local grassroots organizations to get funding in complex settings like this. It's also very hard for local private manufacturers to get access to any capital. So if you are actually operating a live, factory that produces life-saving therapeutic food for kids, for example, in northern Nigeria or any of those sort of difficult settings, lenders don't give them funding, banks and others, even if they can actually show track records, very hard. So what we have been doing as a philanthropy, being a guarantor and helping them access, capital. And for some of them, this has been transformative. So a local producer, for example, had access to $2 million working capital loan, which has now enabled to really slash down the cost of their therapeutics food, which means we're able to serve hundreds of thousands more kids with this. And guess what? They're already repaying the working capital loan because they want this to go back. So now another local producer in another difficult country can access that. It's like a revolving loan facility. And this is future-proofing, but it's also being nimble and taking on risk, which are the things that philanthropy is quite well placed to do. And we can't talk about local actors if we don't mention the community health workers. They're the backbone of a lot of the public health in many of the countries we are talking about. They are my personal heroes. All these years I've been working in international development. Some of my best conversations have been in villages with community health workers. And again, while we are, helping supply them with necessary life-saving commodities, medicines and others, for future-proofing, one thing we're investing is, I was just looking at some of our partners came back from South Sudan, and just yesterday morning I was meeting with them over breakfast. They brought this journal. So CHWs, the community health workers, and these are mainly women, carry 8 of these registers with them. So every time they treat a child for, malaria or child malnutrition, they need to go find the child. It's probably like 5 kilos. I was very tempted to bring it on. I was running around too much today to be able to do that. And it's all, sort of torn apart and all. 8 of those, one is for this ministry, one is for this agency, one is for this donor, one is like 8 of those on their back, in addition to the medicines and the therapeutic food they have to carry. So what we are helping invest in digital solutions, which ties a little bit to Noubar's AI and digital thesis and work as well, which is actually enabling them now to do the entry and verification of treatment for some digitally. This costs pennies. And hopefully we're going to phase out all of these journals and help lift up the life of the CHW, so they don't have to do that. And they spend more time engaging with the women and their communities versus filling out these endless registers. So those are the examples of how we're trying to do more immediate things to alleviate some of that discomfort and help save lives, but also future-proofing the response so that we can be more prepared. And I also, just to say, I really like this due diligence passport idea, or sharing due diligence amongst donors. And indeed, with the coalition that we're now, this alliance of funders we're building to mobilize more funding for humanitarian, we have agreed that we're going to share the due diligence. So we will only do one set, the same way. It's, we're not going to all go do this and that. And I think that's a really good model that we can all work towards, maybe.
Thank you. That does tie into my my next question, which is whether there is, a silver lining to this crisis. I mean, obviously, even before the aid cuts, there was the sector's taking a long, hard look at itself. And I just wondered if each of you could sort of say whether there are, you've talked obviously about some of these positives, but what the silver lining, if there is one. Lucy?
I think I don't know if I would call them silver linings. I think it's easy to sit here in this comfortable room in Oxford and describe them as silver linings. I think maybe chinks of light in the armor might be a better way of describing it. I think a few things. So firstly, we're in this context at the moment of the humanitarian reset and reform and efficiencies and hyper-prioritization. And there is, at the center of at least what we're all talking about and coalescing around, is localization. So it sounds different. I think people are, singing from the same song sheet, finally. I think the proof is in the pudding, like how much that translates into meaningful change that actually enables and empowers local actors remains to be seen, and there are some systemic changes that need to happen. But I do think that the language is changing and the voices are sounding like they're more harmonious. I think we as Start Network are being held to account by our donors to answer questions of what are you doing, what are you changing, how far are you moving ahead with this? And actually that pressure from the donor perspective is helpful. Like, I think we should all be much more accountable when it comes to this core way of working. The accountability can't just be upward, the accountability must be around the communities that we're all here to serve, but I do think that the language has changed. And I think we have some instruments, we have some tools in our toolkit that we didn't have before, that maybe now are getting a little bit more attention, are being more center stage because of the importance of efficiencies. So pooled funds are being talked about a huge amount now. We know that pooled funds are they're aggregators, so they pool resources from multiple donors. That means that the election of one man in one country does not necessarily determine the fate of that mechanism. And I think pooled funds are fantastic for driving innovation. They've proven capable of advancing on localization in some cases, not all cases. But I think the more pooling we have, the more flexibility we're able to have. I will just quickly say that ICVA did a really interesting piece of work last year looking at pooled funds and risk sharing within pooled funds, and they did find that many pooled funds introduce their own levels of compliance beyond what their back donors are asking for. So I think we have to keep a watchful eye on how those pooled funds are actually showing up and meeting the moment. And then the other thing is anticipatory action. I've touched on it already, but we know that there are much more efficient ways of working to protect people that are at risk of crises and then respond early and quickly to meet their needs when those crises emerge. So anticipatory action feels like it's recognized much more widely than it has been in the past. And I think we have to sort of hold on to those, I guess, shifts, because they have the potential to really, really drive sort of much more systemic change. And they have been sort of at the press, they've been on the margins. I think they're now taking center stage, which is good to see.
Thank you, yes. And maybe I'll just give another example of things that we're seeing that could be positive going forward. What we are encouraging and seeing more of, bundling of the health interventions. So the international development aid infrastructure has been set up in verticals, right? And this is not how women and children live their lives, but to deworm the child, you need to take it to this facility, and usually this NGO supports this, then to get the malnutrition treatment is another one, and all of that, as if it were not talking about the same child. And what we're really encouraging and seeing more of, every touch point with the child is so precious, especially in those settings. So when you have that access, do the bundling, provide the therapeutic food for malnutrition, provide the malaria prevention, provide the measles vaccine, because we don't want to save a child from one preventable condition for the child to die from another preventable condition. Whereas before it was, well, that's not, I'm a diarrhea-focused NGO, or I am, just working on neglected tropical diseases. We're seeing much more of this layering, and we're intentionally, as a funder, now requesting proposals which are going to do these bundled services. We've also seen costs are dropping, so we can reach more children and families that way.
So Jamila and Sally, I don't know if you want to talk about chinks of light, or whether if you don't want to talk about chinks of light, if there's if there's sort of any anything final you'd like to say before we go to the questions, any messages?
Yeah, not much. Maybe one positive point that we also can see with all this trouble that people around the world suffer, especially in Afghanistan. With all this pressure that is coming on women on Afghanistan, it also has promoted solidarity. Like before, like every woman NGO was working in separate settings, struggling for raise fund. Now we are coming together, and we are sharing our resources, our expertise. And as before, we were having our offices maybe in 1 or 2 places, and rest of the provinces we couldn't reach much. Now, like as I said, we are scattered. Every home has become a school. Every home has become an office. Now we can see that even sometimes I'm asking that this much skillful women we had in Afghanistan, and we didn't know about that. So those who are lost their job as a civil servants, now they are initiating different programs at their home to bring more women to receive from them the help and support. So this is something very positive. And usually it was in the beginning, like the donors were coming with their strategy, then they were talking with government with their strategy, then based on the setting of donors, the activities were coming in. As you said, maybe lots of capacity building for short time, then after short time, everything was finished. But now I see bottom-up approaches coming up. So now everybody is realizing that we have wasted a lot of our time and resources. Now in this way, people are building up. And recently we have established, not recently, after fall of Taliban, a coordination umbrella. It's a combination of many women-led organizations, and 520 women leaders from 34 provinces of Afghanistan. And now we have joined this network and we are working together. And I can see that although the funding is reduced, but still we are able to do. And hopefully if we are in the position to attract some funding, so I'm hopeful that we will be in the position to, as soon as this dark night is finished, women will be empowered, fully ready, and full of energy to act urgently for development of Afghanistan again. Thank you.
I suppose just the fact that by using lots of different people, different networks, you can make such a difference. We have an app, a mobile app, Save a Child, my charity, and this app provides support to doctors working on the ground in various war zones, disaster areas, remote areas. And what it does, it gives those doctors who don't have specialist skills access, direct access to, we have 300 pediatric specialists in our network all around the world who are ready to respond remotely to these doctors. So a child comes in, the doctor examines the child, not sure what the diagnosis would be or what the treatment might be, and they upload the case through the app. A specialist, it's allocated to an appropriate specialist responds, usually within an hour, and through that network, and they do it free of charge, the specialists, we're able to help thousands of children. And the cost is the cost of making sure those doctors are able to work, are able to go to the hospital each day and treat the children. And in the last year, we've helped around 40,000 kids through this handful of doctors who happen to be female. And they in turn can support their families. This is in Afghanistan, where it's so difficult, as you've heard from Jamila. And it's just utilizing networks. It's getting people to join forces, because you can make such a difference if you work together.
So I'm Hugh Salmon from Global Social Service Workforce Alliance, just picking up on community health workers and bottom-up and locally led. So you've mentioned a lot of examples of health assistance and nutrition and medical interventions. I wonder if you have anything to say about community social workers, community social service workers. Our role is to work with UN agencies, governments, international organizations. We're working in Afghanistan right now. We've been hearing about examples in Sudan when professional social workers left, government structures closed, but local people providing social work were able to organize, and now we're trying to link them with the professional structures which are rebuilding also in Afghanistan against all the difficulties. But defining that social work is particularly there for gender-based violence, for violence against children, for the risks of child labor, child marriage, which can't be addressed by the universal but vital health and education services. So there is a key gap, but there's a huge focus internationally on community health workers, much too little on community social service workers. I just wonder if you have any insights on that. Thank you.
Yeah, no, thank you. Thank you so much for that. And I would love to hear a little bit more about the work you do maybe after this. I think it is very important. We have recently started looking much more into that area, including also counseling, mental health support, because we realize it's not just only the health, but we need to look at the total well-being of the individual, which encompasses all of that. But I think integrating that again, so it's not maybe a standalone service. What you said is really attractive to integrate that already to the health provision, so they can have a complete package. Would be very interesting for us to learn, and especially as we're thinking about this scale up and the next steps. Very happy to hear your thoughts and ideas on how we could do that.
I'm Rachel, I work for Greta Somalia. I'm the only international employee of what is a local organisation in southern Somalia. So really keen to be here. We are a START partner and really appreciate the START network. I think they truly embody localization as a kind of a funding entity and a partner, and it's great. I think we've talked a lot about the kind of some of the systemic changes that we see at the donor level, and we've talked a lot about the potential and the capacity and the the promise of more local funding. But I think we've skipped the fact that there are big international NGOs often sitting between those two entities and those two levels. And I was just wondering, we've delivered funding under USAID, under FCDO, various other donors, but we're never the consortium lead, we're never the prime on those activities. So I was wondering what you thought about the kind of responsibilities of the international organisations and how they should be maybe looking to kind of change some of their practices and their culture in this increasing focus on localisation and making sure that local partners aren't just sort of added to big programmes as a bit of an afterthought or as a bit of an authenticity measure, but truly we're really focusing on locally led solutions and funding them appropriately.
Fantastic to have someone from Gredo in the room. Thank you. Yes, so Start Network is a network of local, national and international NGOs, and that's a diversity by design, because from our perspective, there is an ecosystem that could work really, really effectively if all of these component parts of the system played their role in line with this principle of subsidiarity. So as local as possible, as international as necessary. And I think that's really key. And perhaps just, I often think of Afghanistan, August 2021, and perhaps somewhat similar to the pandemic, when many international actors pulled out almost overnight, leaving many of the local actors as the only humanitarians that were remaining operational. And I don't think that is necessarily something that we would want for the humanitarian system. I think there is a role for international actors to play, but there's a recalibration that's definitely necessary. In terms of the international NGOs or the international actors, the sort of intermediary layer, if you will, there's some really great examples of some of the INGOs practicing what they preach, and bearing in mind that many of these international NGOs have signed up to sort of the Pledge for Change and various different commitments to change their practices, to change their behaviours, to really enable locally led action. So I often think of sort of CAFOD in Myanmar, who were leading a consortium, and then they as part of their sort of plan and their agreement with all the consortium members and the donors, the prime change from CAFOD to the partner at the forefront. So I don't know the name of the local actor in Myanmar, but they took on that priming role, having worked alongside CAFOD for a period of time prior to that. And that's a really tremendous example of an international actor recognizing that they had a role to play that was time-bound, that was finite, and ultimately there was an exit strategy, and the local actor then took center stage. I think that there is, at the moment, a difficulty in as much as organizations are thinking about institutional survival. At a time when we need to all be thinking about the survival of the people that we're here to serve, we are unfortunately thinking about how do we as an organization remain viable, remain sort of standing. And I think we're seeing a lot of international NGOs moving more and more into the pooled fund space, because there's a lot of attention at the moment for pooled funds. So we're seeing a proliferation of pooled funds, not necessarily in a good way, because there's a fragmentation of scarce resourcing. So we are seeing some sort of problematic or concerning sort of, I guess, trends that we just, again, need to keep an eye on. But there are those examples. And I think often, think of the likes of sort of Christian Aid, and I've mentioned CAFOD, World Jewish Relief as another, organizations that are partner-led, organizations whose role has always been, their mandate has always been to work directly with local partners who are the implementers and the hands-on folks, and enable them. And I think just one other quick example is the sharing of indirect cost recovery. So the keeping the lights on costs I touched on earlier. I think it's really telling when you look at an international NGO that works with partners and look at what policies they actually have in place to meaningfully shift things. Are they retaining all of those overhead costs themselves? Or are they passing a fair amount to the local partner? And I think it's those little details that actually we should be holding people to account for, but the donors have to help us, because ultimately the buck stops with where the money comes from. And if the back donors, particularly our institutional government donors, if they are not holding those international NGOs to account and asking them, how will this change? What is your role? What is your added value here? We're not going to see much change. Like, it has to come from all parts of the system.
Thank you. I think that's all we have time for. I just wanted to very, very quickly sum up just a few points that I thought stood out for me, really briefly. Just one that sounds like a no-brainer, but obviously trust is crucial between donors particularly and small organisations who have to be trusted to be able to act fast and do their, life-saving work. There are some, let's call them chinks of light, thank you, Lisa, in coalitions and alliance building that's happening. There's a role for the private sector, as Anna was outlining. It's really important to consider kind of localization and regional partners that could offer new ways of working, in addition to kind of national partnerships. And finally, the really important point Jamila made about solidarity, which, under extreme circumstances, but is, heartwarming and heartening. And just wanted to say thank you so much to everybody on the panel. If we can give them a round of applause. Thank you.